Here's a quick quiz to test your knowledge of some of the key points we've covered. First question, what type of bacteria causes Lyme disease? The correct answer is Borrelia burgdorferi. Next question, what type of tick is responsible for transmitting Lyme disease to humans? The answer is the deer tick, also known as the blackleg tick. And the third question, what is the most common early symptom of Lyme disease? The answer is erythema migrans, which is a distinctive skin rash that appears at the site of the tick bite. I hope you did well on the quiz. Did you know that Lyme disease has become one of the fastest-growing infectious diseases in the United States? It is now the most common vector-borne disease in North America, with over 470,000 cases each year. However, it's estimated that up to 300,000 cases go undiagnosed, and many people suffering from Lyme disease are never even aware they have it. So today I'm going to share with you this silent epidemic that is affecting so many people that you need to be aware of and know how to protect yourself against Lyme disease. From an emergency room doctor who treats everything from COVID to gunshot wounds, burns, you name it. This video series is created to help answer some of your medical questions and the questions that are commonly asked by patients. If you find this video helpful, please do me a favor and subscribe. So let's start with what is Lyme disease and how do you get it? Lyme disease is a bacterial infection that is transmitted to humans through the bite of an infected tick, and if left untreated, it can cause some very serious health problems. Lyme disease is caused by a bacterium called Borrelia burgdorferi, and it's most common in the northeastern and upper Midwestern states, as well as parts of California. However, it is becoming more common throughout the entire United States. The bacteria is transmitted to humans through the bite of an infected deer tick, also known as a black-legged tick, and the risk of contracting Lyme disease increases the longer these ticks are attached to the skin. So it's important to remove ticks promptly after finding them. And this is especially true for children and the elderly who may not notice a tick bite right away. Early symptoms of Lyme disease can include fever, chills, headache, fatigue, muscle and joint aches, swollen lymph nodes, and a distinctive skin rash known as erythema migrans. And it's important to note that not everyone will develop this rash. However, if you do see a rash that looks like this that is expanding outward from the site of the tick bite, then you should definitely seek medical attention. If left untreated, Lyme disease can spread to other parts of the body and cause a variety of severe symptoms, including arthritis, facial palsy, heart palpitations, dizziness, and shooting pains. And in some cases, it can even affect the brain and spinal cord. And while these are certainly scary complications, it's important to note that early diagnosis and treatment can effectively prevent these serious complications from occurring. So who is at risk for getting Lyme disease? Well, anyone can get Lyme disease, but certain people are more at risk than others. This includes people who live in or visit areas where the disease is common, which we talked about earlier in the video. People who spend a lot of time outdoors, such as hikers, campers, and hunters, and people with weakened immune systems. And what are the ways to prevent Lyme disease? Avoiding areas where ticks are common is one way, but since that's really not practical for most of us, there are other things that we can do to lower our risk. These include wearing long pants and tucking our pant legs into tall socks when we are in tick-infested areas, and using insect repellent containing 30 DEET or picaridin according to the instructions on the label. And it's also a good idea to shower within an hour of coming indoors after being outdoors, especially in areas with high tick population. And we want to check ourselves thoroughly for ticks, and then put our clothing in the dryer on high heat for at least 10 minutes. Within 24 hours. Now let's talk about how is Lyme disease diagnosed and treated. If you think you may have been exposed to Lyme disease and you're experiencing symptoms, it's important to see a doctor right away. Early diagnosis and treatment can prevent the disease from progressing and causing more serious problems. Doctors will ask you about your symptoms and any recent tick bites, and may perform a physical exam to check for signs of the disease such as the erythema migrans rash. And while there are blood tests available to detect Lyme disease, they are not always accurate, especially in the early stages of the disease when symptoms first appear. So if you have been bitten by a tick and you develop symptoms, don't wait for a blood test to confirm the diagnosis before starting treatment. Your doctor may prescribe antibiotics to treat the infection, and it's important to follow the full course of antibiotics even if your symptoms improve before the medication is finished. So if you've made it this far into the video, you are clearly concerned about your health and the health of your family, and I appreciate that. So here's a quick quiz to test your knowledge of some of the key points we've covered. First question, What type of bacteria causes Lyme disease? The correct answer is Borrelia burgdorferi. Next question. What type of tick is responsible for transmitting Lyme disease to humans? The answer is the deer tick, also known as the blackleg tick. And the third question, what is the most common early symptom of Lyme disease? The answer is erythema migrans, which is a distinctive skin rash that appears at the site of the tick bite. I hope you did well on the quiz. And remember, knowledge is power when it comes to your health. So keep learning and stay healthy. As we continue to learn more about Lyme disease, it's clear that this is a complex and challenging illness to diagnose and treat. While antibiotics are the standard treatment for Lyme disease, some patients experience symptoms that persist even after completing a course of antibiotics. This has led to increased interest in alternative treatments for Lyme disease, including intravenous immunoglobulin therapy. Intravenous immunoglobulin therapy, also known as IVIG, is a treatment that involves infusing antibodies from healthy donors into the bloodstream of patients with Lyme disease. The idea behind this therapy is that the donated antibodies will help to fight the bacteria that causes Lyme disease and alleviate symptoms. However, it's important to note that the use of IVIG for the treatment of Lyme disease is still considered experimental and is not widely available. So what should you do if you think you may have Lyme disease? If you suspect you may have been exposed to Lyme disease and are experiencing symptoms, it's essential to seek medical attention promptly. Early diagnosis and treatment can significantly improve outcomes and prevent the disease from progressing. A healthcare professional can assess your symptoms, perform a physical examination, and determine the appropriate course of action. They may prescribe antibiotics if necessary and monitor your progress to ensure the effectiveness of the treatment. So I would love to hear from you. Have you or anyone you know ever been diagnosed with Lyme disease? What was your experience like? Share your stories in the comments below. And if you enjoyed this video, please do me a favor and click the like button. It really helps support the channel. And don't forget to subscribe. Thanks for watching. Stay healthy and take care.